Okay. Okay. Assalamu alaikum warahmatullahi wabarakatuh. I'm sitting upstairs. This is the room. On this side, these are made by Sister Salwa. She makes
Oh.
yeah, so she gave me so many macramos. And these my flowers, these are my old flowers. I bring them.
Mhm.
I like the roses. And
These are
dry
real
out.
flowers, natural.
Yeah, yeah. And when they
Mhm.
dry out, I don't throw them. I really use Uski, they still smell. So they're sitting in this corner
Mhm.
with my cabinet, and so it's all I have cleaned everything. So it's not. It's just the things that I like old and my friends think. Okay, so let's start for the class today. Anyone has any question? I have. Okay, I have. Mm, I was looking at the stuff, and I have collected some of the material that is, let me see, desktop. Okay. So I like last time I talked about the headaches. So I have some, you know, important thing in this homeopathy and the discussions is, first of all, that I am a homeopath. I have been trained and in International Academy of Classical Homeopathy. And the thing is that, like any other way of treatment or way of healing, um, we have to go to school. School means we have to go through a structured training to understand and then be able to heal or help in the healing process of ailing people, including ourselves. So primarily, what I'm trying to do is educating. Okay. So the Zoom sessions or these discussions which I'm giving are for educational purposes. They are not. I will not tell you to do them on a regular basis. Sometimes, like when we talk about aconite, we talk about arnica. In 30C, it's over the counter. So this shows that they are not harmful. So use them as depending on the condition, but please, for any chronic condition, for any chronic ailment, for any long-term um, uh, any metabolic disorder like diabetes, any of the hypertensive disorders with other chronic conditions of the body, please do not self-medicate. This is not appropriate. This is not encouraged. This is because this is a serious matter, and sometimes we are not able to assess the main and the important aspect of the person, and maybe the person is really showing some signs of very serious illness. And if we are self-medicating homeopathy, thinking, okay, this can result in such and such with I mean such a remedy can give such and such result, maybe we are not doing or we are not assessing the patient properly. So please don't take things in your hands. This is a very, very important advice. And in cases which are really serious, talk to medical personnel and talk to a proper system. Okay. After having said that, does anyone has any question? Because I want to study, I want to reinforce some of the things that we have already discussed in the previous classes. And one of them is the use of aconite. Okay. Aconite, I cannot say how useful is this aconite. Aconite is a remedy, like we already said, it's made up of, it's not made up of, it's extracted from the flowers. But this is extremely useful remedy for fears. And when, who has not, Allah says, I mean, He tries the people with fear. Fear is a protective phenomena, okay? If we become totally fearless, that's not good either. But fear out of proportional will hinder in our daily life activities. So when this fear is overwhelming, uh, due to certain conditions, due to certain situations, we have to deal with this fear, right? We comfort the person who is fearing, and we also give the homeopathic remedies. So aconite, aconite, aconite. Like we always talk about two sisters, aconite, and the other one is, okay, we will talk about that. So aconite is A for aconite, okay, A for aconite, followed by a C. Aconite is extremely useful remedy for fear. When can fear happen? Fear can happen in children. Fear can happen in children when they see movies with, like Jurassic Park. Somebody saw, a child saw a movie with Jurassic Park with, big dinosaurs, or some other movies in which the children, they see some animals or some people being acting in a way that they get scared. So this is very, very, very important that we take care of that fear and give aconite. I want to stress that again and again. There's this one I want to mention over here, and I have mentioned in the previous sessions also, that aconite is also very useful for fears. When people, I was listening to this one lady, she said one of her nephews, he's an adult, he's a married man, and he's so afraid to fly. He doesn't go in the country from one place to another on the plane because he's so scared. But when he has to go to overseas, he has to fly. He cannot go there by road. And he acts like a child. Aconite would help him. Believe me, if you give him aconite, uh, in higher potencies, okay, 1 m and more, it will help the person who are very, very afraid of things. Aconite. More so, we'll talk more about some other remedies. So aconite, important thing is, the important part of homeopathy is, you know, when a person is going in depression, or when a person has depression, or when a person has stress, what do allopathic or other conventional medicines do? They suppress it. The person is looks like they're laughing and they're giggling, but inside the emotions are suppressed. They're not able to cry. They're not able to show and express their emotions in a way that are natural. Homeopathy doesn't do that. Homeopathy helps to channel these emotions in a way that is not hurting you bad enough. It allows you to be aware of your emotions and do something about it. Okay? And it helps you calm down. So, homeopathy does not suppress emotions like tranquilizer, etc. More so, one more thing is that whenever a person, say, has people get into accidents, right? People get into accidents, and what is the first remedy for accidents? What's the first most important remedy for accidents?
Arsenicum.
Arsenicum is A. Arsenicum is
Arnica. Sorry,
oh,
arnica.
great, 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 great answer. Great answer.
Mhm.
Arnica. Please do not remember this healer. This arnica, please do not remember. I mean, do not remember means do not forget. Look at me. Sorry, misplaced words. So it's, but before arnica, because when you have a, say, God forbid, an accident, what is the first emotion that happens when a person gets into an accident, whether it's big or
Fear,
small?
fear, fear, fear,
Fear.
fear.
So
Correct.
give aconite. Give
Mm-hmm.
aconite so that person is not frozen anymore, and then give arnica. So just give me, when will you give aconite? And okay, important thing. I did a class of Easy Homeopathy. Easy Homeopathy is the name of the book. It's not that homeopathy is easy. And there were 7 remedies. Then I prepared those 7 remedies and gave it out to my students. Please have this small little pouch. Put those 7 remedies, small little bottles. If you can buy a kit, okay, buy it. Otherwise, I prepared those remedies and I gave it out to my students to keep. And I had small pouches. I found them in a shop. I had small pouches and I put those remedies, 7 remedies to keep. So aconite and arnica are always there. So if you see a patient and put a small pellet on the side of the mouth, okay, over here, put that in there. After some time, when they're a little bit, after some time is 5 minutes, depending on, give arnica, okay? Because in the case of trauma, you don't have to wait, oh, let me wait, oh, did he eat, oh, this, no. And believe me, these small little pellets, they are not going to roll down and get stuck in their throat. They are very small sugary pellets and they get dissolved very easily in the mucosa. They are sucrose. They do not go, they are not like hard balls. But even if you are scared and if you happen to keep a water bottle, put that small pellet in the bottle, water. I would take the bottle. I don't have a bottle right now. Otherwise, I'll show you. I'll put some water in the cap, you know, uh, I don't have the bottle. I'll bring it sometime. I will show you, demonstrate. So on in the cap, put some water, put this pellet, put drop of drop a drop in the mouth on the side. Believe me, it's not going to choke him. It's not going to, God forbid, if he has been taken to the hospital, it will not make him die. Believe me, this is not going to happen with this one tiny drop on this. And if you're again so fearful, dip your hand and put it in the mucosa, like dip it. If you're very fearful, because I've seen people, I was pushed away, thrown away. This lady, she said, I will not let you do this to this lady. This lady had a head trauma. And she said, please give me some homeopathy. And there was a nurse. She pushed me away, threw me away. She said, I will not let you do anything till the time paramedics come. You're going to kill her. No, no, I'm not going to, we're not going to kill nobody by putting one drop. And Sadia is also a doctor. People don't die like this, is not going to choke them. We're not putting a 1 gallon of water in their mouth. So to cut the story short, give aconite and then in 5 minutes give arnica. Okay. In your acute homeopathic first aid, that either you keep L potencies or you can keep 1 m. Okay, for the acutes, use 1 m. Dr. Luke says, and even it's also said by Dr. Henneman, 1 m are very, very useful for acutes. Okay, so again, I would stress that again, that please use aconite before arnica in the case of acute trauma, because fear is a very, very important factor or very, very important emotion in any or kind of injury. Okay. Anyone has any question? Somebody said arsenicum album. You know, arsenicum album is a very useful remedy. And nowadays mean currently I have quite a few patients, quite a few means of my patients who are using arsenicum album, but that's their constitutional remedy, and I am prescribing them in LM potencies, and some of them they are using it over the period of months and years. This is the beauty of LM potencies, that you can use them for longer period of time. And arsenicum album, when we discuss its acute um, presentation, which can be acute cough or it can be vomiting, acute food poisoning, but it is a very, very important and deep remedy. Okay, So I want to say about this aconite and arnica. Very, very useful. Two sisters always go hand in hand. Please keep them in your pouches, in your first aid small pouch. I always keep them. It's downstairs. I'm sitting upstairs in my bag. I always keep them in my bag. God forbid if something happen and I need to use it, I use it. Anyone has any question? And this article is about aconite. Aconite is very useful. It's very useful for acute fears in children. And believe me, one more thing. It's not that you just use it for acute fears and that's it. No, it's not only that. It's can be used for longer period of time. Aconite. It's not that the fear happened and then you said, oh, no, no, the fear was not acute, it's going on for a long period of time. Yes, you can use it, but also get their tests done. I will not tell you, okay, go ahead and keep using aconite for, get some tests done and go and show them to the medical personnel. And then, but aconite is extremely useful remedy. Anyone has any question? How are you doing, Sister Hamada? How are you, Sister? I think this is Samsung is my dental surgeon.
Hi, Doctor.
Right?
How are you?
Alhamdulillah, alhamdulillah. Okay, so this article I pulled up because I wanted to talk about this aconite. It's and it this when you see this article is written by Easy Homeopathy, the 7 essential remedies you need for common first aid, and this is written by uh, Edward Schultz. This is the Dr. Edward Schultz. He's an MD and he also has a diploma in homeopathy. And he practices classical homeopathy and holistic psychiatry in New York City. And he's from Russia and all that. And he has these two books. I have both the books. And I talked about this Easy Homeopathy, the 7 essential remedies. I discussed this book in my whole one class because it covers the main ailments which can happen to a person. And the next book, which was is there, I didn't enjoy it as much as I enjoyed the first one. These 7 essential remedies is a very easy read and very, very useful. Okay. So if do you have any question? If not, let me go to the next part, which I wanted to show you and discuss about. I remember we said I want to talk about two things today after this. And if, yeah, one is palliative care. Okay, palliative care is also very useful. What do you mean by palliative care? Do we know what a palliative care is?
Before the disease.
Uh,
Palliative. Oh, before.
Palliation.
Yes, before حفظ ما تقدم like.
That's prevention.
Okay. Oh, palliative care of
Hospice.
geriatric medicine. Yes, yes,
Doesn't
yes.
have to be
Oh,
geriatric. Anybody who is
oh.
dying,
Any dying patient,
any
and
person who the
uh-huh.
people have given up on.
Mm-hmm.
Who has been given up from the conventional medicine, they say we cannot do nothing now.
Yes,
Take him
yes, yes.
home or put him in the hospice and give him whatever. Do not bring him back to the hospital where they can treat and they think that they can cure the people who have some chances to live further down the road. Palliative care is hospice care. Okay. So homeopathy has a big role in palliative care, in hospice care. It will help you with the meaningful final days. Why I'm saying that? Because I I want to go into that. That's like drama, but it's useful when people have the conventional doctors. They have given up, or they said they believe that they cannot give any purpose of full medicines, then they say, okay, then these people, they think that they have the right to die in, according to them, in peace and without pain and fear, and they can die easily. I cannot comment more than this on that, because I do not have extensive information to discuss, and it is a very open and heated argument. Okay, so leaving that aside, first of all, these are the two things that we need to be aware when we are using the homeopathic remedies. First is, please give them on empty stomach, preferably empty stomach. But sometimes, if a person has eaten something and you have to give them the remedy, give it. But if it is like an everyday, like if I'm taking LMs, okay, and I know I have to take LM morning and evening, and it is already pre-planned, then I should be mindful, okay, let me give a break before I take the remedy and the food or drink that I take. I should keep a gap of 10 minutes. This is always advised in a pre-planned remedy intake. Secondly, avoid strong odors in homeopathy. Strong coffee, many homeopaths, they say, oh, no, no, coffee, no problem. But I am the school of Professor Vitokas. He is not a coffee person. But again, since alum potencies are being taken very frequently, this coffee, because many of my patients who are they have chronic conditions, they are coffee drinkers, especially my Middle Eastern friends and patients. So, and they have this craving. So I prescribe them LMs because they're taken so frequently. So this coffee habit is also taken care along with this uh, LM potencies intake. Okay, that's one thing. But avoid strong odors. I don't put on perfumes, but strong odors of perfumes and essence, they also have an effect, not a positive effect, on homeopathic remedies. Okay, so generally, for even palliative care, since the person who is not well and he is having very low vital force in the cases of chronic ailments, the body is give 30C potency. By rule, they say use 30C. Or you can, over here, they have not mentioned alums. Alums you will see very infrequently. Or use alum potencies. Okay. What is the dose? Many people they ask, okay, what is the dose? How much can we give? Can we give one pellet or two or three? How about if oh, somebody said, oh, I just take 10 of them. Is it okay? Yes, it's okay. But please don't do that as a habit. Uh, so 2 to 3 dry pellets are appropriate. 2 to 3. Okay. Don't use more, don't use less. 2 to 3 is good. Even if you don't have enough and you have one, okay, take one. So, uh, and then I'm asked a lot of time, can I take it dry or can I put it in the water? Sister, you can take it dry if you do not want to drink ever a sip of water. But what happens is when you put these pellets in the water and you take that water in the mouth, it goes in a large, in your mucous membrane, is exposed to a bigger surface area, right? Surface and area. It's not a big word. And that's why it would be absorbed more rapidly and it would act where it needs to act more rapidly. Okay, so this is and if you have to repeat it, what I do is I put 2 to 3 pellets in a bottle of water and I put it in the fridge, and then I use it for whenever needed for at least 1 day or two, and then I change the water bottle. Okay. So how do I give one dose? Again, you can put one dose again. Now, what is one dose? One dose. This is a dose. When we say doses, we say how to make a dose. How to make a dose is by putting 2 to 3 dry pellets in water. How much water? It can be 1 glass of water. It can be 1 16-ounce bottle of water. Put it in there, and this will create a dose. A dose. Now, how often can you take it? You can take this water and you can make 2 to 3 doses out of it. Or if you want, if you're thirsty, you can drink the whole water, whole bottle of water or the glass of water. It can be 1 dose. Did we understand the difference between the doses and the pellets? If this water you take 2 to 3 times a day, that would be 2 to 3 doses. You understand? So this is water, and nowadays many homeopaths, they call it water dose, and they put the remedy in the water and they tell their patients to take it frequently till the time they get better. So water remedy mixtures are very popular by the patient, by the homeopaths nowadays. Okay. Now it's saying how often can I give a dose? Repeat the dose as needed. Since this is 30C, it's not going to be harmful for you. As needed means if you are in pain, if you are have headache, and if you are have some injury, repeat it as till the time you feel some relief. This is 30C or 1 lm. Okay, so repeat as needed. It can, the duration between the one dose to next can be 5 minutes or less also. Okay, so it can be like that every 5 to 10 minutes. If the person experiences relief, then uh, if then increase the duration. But if they feel the relief, but then again the pain increase, then increase the potency of the remedy. Am I clear? So from 5 to 10 and to 200 C potency. Am I clear? Anyone has a question about this? Is very important. This is a very good answer to all the questions who are using the remedies. You can say 30C potency over here. I can replace that 30C with LM1 potency, and I can do the same. And this is my
Sister Michelle, can you repeat the answer, please? Because I had a weak signal.
okay. Say that again, sister. Can you just repeat your question? I'm sorry. Did anybody understand the question? I'm sorry, I couldn't catch. Sadia, did you understand the question?
No. I think she's asking for potencies. But
Okay,
I didn't
something about the
understand.
potencies. Okay, let me say. So, first and foremost, for all the people who do not have any degree in homeopathy, please use 30C. Okay, they put the 30C out on the counters on homeopathic stores. So do not go more than 30C unless you have a homeopath who prescribe you. This magazine is for homeopaths also. So in the general instructions, this is how to make a remedy dose, water mixture of remedy dose. So take your 30C potency of remedy, take, and then I will demonstrate it in the next class. I don't have it in front of me. Then you open it and you pour those 2 to 3 pellets on the cap of the remedy. Or sometimes the remedies which are dispensed by some of the homeopathic stores, they have a revolving, it moves, and on the top, 1 or 2 pellet, one pellet comes out when you move, when you move the bottom screwed aspect of this bottle, if I am making sense. So take 2 to 3 pellets, whatever way. Do not touch with your hand. Please do not touch with your hands with these pellets. So take 2 to 3 pellets in the cap of the bottle from which is having this remedy, and put it in 1 ounce of water, or I would say 1 glass of water, or 16 ounce of water bottle. Okay. This is preparation of the dose in homeopathic remedy. Okay. Again, word of caution in alum. In alums, we use as taught by Dr. Hahnemann, distilled water, alum potencies. But if you do not have distilled water right in your hand, please use the water which is available and look for the distilled water and get it as needed, case needed be, to get the maximum benefit out of the homeopathic medicine or remedy and the potency. Okay, so we got the medicine, the name of the medicine. We took 2 to 3 pellets of that remedy, and then we have either a glass of water or we have a bottle of water, and then we put those 2 to 3 pellets in that water bottle. If they 4 went in there, no problem. Don't worry. Don't rush to bring one out. No, let that be in. Okay, let all of them enjoy. So once you finish putting that, cap it, shake it. This is the preparation of the dose of homeopathic remedy. Now, how often do you take it? If you are thirsty, if you want to drink all of it, drink it. Little bit left, add more water in that bottle. Okay. This bottle of water with the remedy in it can be taken on as needed basis. As needed basis means you can take it right away in 5 minutes or 10 minutes, you can repeat it till the time you feel some ease in the condition that you're taking on. For example, fear, right? If a person is extremely fearful, and then you give him or her aconite in that water bottle, give one sip, and baby was like crying out of the fear, not able to sleep. He felt maybe stop or decrease in crying, but if no, just after 5 to 10 minutes, give another sip. Okay. And if the baby is screaming and won't take it, another day I got this information from a homeopath. Put one drop on the back of the hand over here, rub it. If he's not taking by mouth at all, children are children. They're fearful, they're sick. So don't go over there. Oh, so put it over here till the time child calms down, and then give him or her water. Repeat after 5 to 10 minutes. If the person is relieved, well and good, increase the duration in between the repetition. But this article says, and expecting this to be read by homeopaths, that if there is relief, partial relief, followed by again increase in the severity of the symptomatology, increase the potency from 30 to 200 C. Okay, so is it clear? If not, bring some questions and we'll discuss next time. Okay, so let's do this one and we'll discuss the headache maybe next time. Let's discuss some of the remedies that are very, very useful for people or patients of any age in hospice care. First and foremost, again, you will not get away with anything without aconite. Sister, fear of death, fear of unknown, generalized fear, it is there, especially in the people who know that they're dying, right? So aconite is very, 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 very useful. One time, I was talking to my friend, and she was overseas, and she said she didn't know what's going on with the mom. And mom is old, almost 90 years old, and she did not have much remedy. She had just aconite. She gave her a dose of aconite 200. I don't know who told her, but she was far away. Mom got better. And then they took her to the hospital and they did what they needed to do, but mom got better. And then the brother who has lots and lots of family responsibilities and etc. He said, "Can you give me one of that remedy?" He was going through some things he did not mention, but he got better. And he says he kept the whole bottle from her. He said, "I couldn't find it, and when I asked, he says, no, I'm not giving it to you. You can go get yourself another one. We don't find these things over here." So aconite is very, very useful, sisters. Second important remedy, which is very useful and you might not have heard a lot, this is aconitis from the flowers, right? This is called Antimonium tartaricum. Antum tar, the smaller, maybe Sadia, you must have had heard it from your dad. Antum tar.
Yes, yes. Antimonium tartaricum, full name.
Yeah, Antum tar, but Antum tar, I have used it a lot for asthma in my one of my boys when they were very, very young, with a rattling cough, with lot of mucus in the chest, but they are not able to expectorate. Expectorate means bring that mucus out. Oh, they will cough with, and you feel like the chest is full of mucus. Okay, and due to the condition, they are not able to take that mucus out. And the people who are breathing at the end of the life, and their their breathing is shallow and quickened, and then you feel like there's a mucus in here. And in the hospitals, in ICU, they will try. I have done that with the suction. They will suck the mucus from the throat, from the mouth, and but we cannot go in the trachea down, or we cannot do nothing about it, right? And really the breathing is really very hard. It's called death rattle. Antum tar, give them antum tar. Okay, what potency are you going to give them? Antum tar, what potency, sisters?
30C.
30C. We are just talking about, or preferably what potency? LM1. Okay, 30C or LM1. Please be aware of LM1, get LM1s, make a kit of LMs. Please do so. Okay, so it will help. It will help a lot. Cane, when there is a newborn, just born, and it was hard for the baby to breathe. And then when he breathed, when he's not breathing, he's turning blue, and you feel like, and you're slapping. When the babies are born, Sadia must have known, we and maybe sister Mama, we just slap. We just turn the baby upside down and we slap in the back. Boom, 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 boom. I have done that. I have done that one, this baby. I was not sure whether he's going to come to life. Alhamdulillah, he came to life. We love the baby crying when they're born. That is very important and very healthy sign of life and strength in their lungs. So if they are not breathing when they are born and they are blue, turning blue, and you feel like this, we're sucking their, give antum tar. It will bring them to life. Okay, and this is where I learned that from. I took a class with this nurse. Not She's not a nurse, she's a midwife, a homeopath midwife. She was a nurse. I am not. Yes, she had a nursing degree, and then she turned as a midwife, homeopath midwife, and she helps deliver babies, and she used homeopathy, and she uses antum tar. And I have read that it is a very important use of antum tar for the newborns. Thirdly, Arnica montana. Arnica montana. We have to make a song of this aconite and arnica, two sisters going side by side, hand in hand, happy la 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 la, because they bring people to happiness. Arnica montana, following the surgery or injury. Okay, aconite and arnica montana. So now the fourth one is arsenicum album. Arsenicum album has deep sense of insecurity. How can we be secure from death? We cannot. Whether we say, oh no, I'm not afraid of death. Oh, everything, yes, everything is in God's hand. He is almighty. He is without fear, and he gives us hope in him. But fear is there. Fear is a very protective phenomena for the human beings. So if the person is very restless, very cold, at the same time having burning, and cannot go to sleep, and says it's not fear, arsenicum album will help. Especially at 1 a.m. means in the middle of the night, got up. If he wants to walk around, if not, he's just tossing in the bed, moving, okay, and have burning pains. Maybe want sip of water, not waters, water, having pains, extreme degree of restlessness. They will not accept, but they will have fear of death. Give them arsenicum album. It will give a lot of relief. Okay. Anyone has any questions so far? Anything that they said? Carbo vegetabilis is called corpse reviver. What's the meaning of corpse reviver? What do we mean by corpse? What is the meaning of corpse? What is the meaning of word corpse? Corpse means dead body.
Dead body.
Yeah. And what is reviver? Bringing back to life.
Yes.
So carbo vegetabilis is a charcoal. Okay. If you see, then people have seen it. If you see a person fell down, he's turning blue, he's cold, hands and feet are cold, it looks lifeless, you feel like he's dying, he or she, whoever, give carbo veg. You will bring the person back to life. Okay. Person is collapsed. Okay. And people are saying, oh no, he's dead. She or he is dead. They have icy cold skin. Skin is cold. Make a note of this. I have used this carbo veg, and because I saw my mother one time, she collapsed. It was a wedding of my sister's daughter, and she collapsed. And my sister, the mother of the bride, she started crying. And they were, I don't know how many doctors in the wedding, because my sister is a doctor, etc., and her husband. And she's crying, and my other sister, she started taking the blood pressure. She says, I cannot find her blood pressure. I cannot record her blood pressure. I cannot find her pulse. She's a doctor. And she said in a loud voice, guess what I did? I ran to the room where they had given me. I opened my bag. I took the carbo veg, put it in the water, brought it, I put a couple of drops in my mother mouth. And behold, Alhamdulillah, she woke up and she said, what are you doing to me? And then, mom. And then we said, oh, thank God she's okay. And we took her to the room because she had she had an accident. Later on, she said, how come nobody took care of me? Why didn't you take me to the hospital? Or nobody was a doctor there, and there were 15 doctors because the family had so many friends. Alhamdulillah, but I cannot forget that time with the carbo veg. Carbo veg, it has helped a lot of people, okay, and including my mother when my sisters were crying, and they both work as doctors in this USA, okay. They're working in the hospitals over here. Okay, so let me do these two more, and then I would discuss the later on next time, because it's too much information, and that gets boring and people get saturated. These two remedies are, I have used them a lot. This remedy, coffea cruda. Coffea cruda is made from caffeine. Sister, there is this, currently one of my patients is using it, but he doesn't use it as prescribed. He uses it as he wants to. Okay, now I'm coming off the track. It's not a hospice. He's not in a hospice care. Works overseas, and he'd been working overseas for. He is in his 40s, I think. He's working for more than 20 years. He's like burned out, works like 22, sometimes 22 hours a day, sometimes less, more. And he had such a severe breakdown at that point that he tried to commit suicide. Now, I'm not telling you to treat such like patients, okay? And sometimes my patients, when the family member, they talk about them, they are not fully aware of their medical situation either. So, to cut the story short, this gentleman was in a very bad shape a couple of years ago, so much so that he was sent to Pakistan by his other brother, don't know how. And then he was taken to the psychiatrist and he was put on a lot of medication. He revived. He was better. Then he's again back to overseas because he has to feed the family back home, right? So this lady, she talked to me. She said, when I'm going to go home, back home overseas, I'll see my brother. Do you have any remedy? And this friend of mine, she just uses the remedy at her own choice, not as I prescribe her. So I said, what is the main symptom? She said, no matter what he said, he cannot sleep. He becomes sleepless with stress or anxiety. We don't know whether he's taking, he does not, or he's not on any intoxicants, but whether he's drinking coffee or not, wallah alam, I don't know. So I said, okay, there's something which we call opening the case. So I said, I need more information. So for the time being, take this. And I gave her coffee cruda. I said, take this and give it to your brother and tell him to use it and give me more information. She took the remedy. Did she give me more information? No. Did she give the remedy to her brother? Yes. Did he take it as prescribed? No. Now, he is overseas again and he's complaining of again the stress and anxiety. And I said, what remedy did I give him? Because I needed more information. She said, okay. I said, tell him to send a picture. And it was coffee cruda. I said, is he taking it? She said, I don't know. I said, ask him, please tell him to take it for a week at least. And it is an LM, okay? LM. Why am I telling this whole story? Now, it has a purpose. Now, she said that currently he is again stressed, but previously, when he was too stressed, he would stop talking, he would stop sleeping, and he would stop communicating with anyone. This time it's different. He's stressed because, he might be presenting with a new remedy picture, but they are not aware of to give this information. He takes coffee cruda maybe, I don't know, once in how many days, and it is LM, very small potency, but he is talking. So there is some effect of this coffee cruda on the person who was in the psychiatric uh, ward because of this acute stress, not acute stress, acute on chronic stress and along, but the picture is not clear. So coffee is very, very useful. The last remedy which I would discuss today, and then I would call it for the day, is Ignatia amara. Ignatia. Please keep it in your pocket. Please keep it in your pocket. Because we women, we can have this emotional attack. We can not, okay, I'm not saying about myself. I can say about myself, why not? We are all women. We have emotional uphills, downhills, and emotional variation, and especially the women going through the cycle, so much of hormonal uh, uh, fluctuations. But Ignatia Amara is specific for grief, and also for the panic attacks due to some loss. It's very, 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 very useful. And in this case, what happens is that the person will have spasmodic weeping. They will cry with, I mean, they, I cannot, I mean, they will cry, they will gasp, okay, and they will cry, cry and cry and cry, and they will not be able to control themselves. They'll be gasping for breath while crying at the same time. Very, very emotional rage stage. Okay, Ignatia would help. Please keep Ignatia. Somebody has lost a loved one. Use Ignatia in the initial phase of grief, immediately before and even for the person who is dying and who is crying and is very, very emotional, use ignitia. Okay. So that's all I think we should do today. More would be too much. Anyone has any question? I have more things, but it would be too much to do. Anyone has any question? I talked a lot. Anyone, please? Did everybody understand?
السلام عليكم ورحمة الله وبركاته.
Salam, Sister Naima.
I try to write as much as I can. I
Oh
did an
my
document,
God.
but is there any way we can print all these information?
Oh, yes, yes. I will send you, if you want me to send it through the email, inshallah, I'll do that. Or if not, I send everything, this chart, I will print it and I will send you in the WhatsApp group. Okay.
And you know, when you were talking about the mucus, that's when two of my friends, they had cancer in the hospital and they were suffering from it. I wish I knew.
Allah. Yeah, but now you do.
Yeah.
Yeah, yeah, they
Subhanallah.
help. They help. Yeah. Okay.
Oh.
Anyone has any question so far?
No questions.
Okay.
Next time we are going to do headaches, right? The
Yes,
migraine.
yes, you want to do
Inshallah.
headaches. Okay, let me say headaches are two kinds, primary headache and secondary headache. What is a primary headache? Primary headache means the headache which is originating in the head, in the muscles, the bone, anything inside around the head area. The secondary headache is the headache which can happen because of the general body metabolic disorder, chronic disorders, and on top of it, you're getting headaches. Maybe the person is taking the medication and having headaches or anything. So I was looking for this article. It was a beautiful article on primary and secondary headache. There are also tension headaches. There can be migraines and sinus headaches, headaches due to the sinusitis and sinus pressures. I have had those headaches in the past. They're really very, very terrible. But we'll talk about that. Okay. So if you have any question, let me know. Otherwise,
Okay, I have a question. Hanan, 2 days ago,
uh-huh.
she had severe